Tell me a little bit about some of your early experiences with the SafeMed program.
Okay. One patient in particular we've enrolled 4 at this point, and Mr. F was one that really hit home with thinking about seeing the patients that we're really truly going to be able to help from a disease state standpoint, medication issues and medication assistance. And Mr. F has a difficult time affording his medications and is on a very restricted budget and can only afford about $40 to $50 worth of medications a month. And the cheapest I could get his medication was about $175 to $200, and that was getting the generic, $4 prescription plans and things like that. And so after phone calls to Social Security Administration, his Medicare plan, social services, we worked it out for him to be able to participate in extra help, which will give him up to $4,000 in medications a year. So he's going to be able to afford all of his medicines after many phone calls and talking to him and talking to physicians. We've been able to work out the cheapest list for him and have had positive feedback from physicians just today on helping Mr. F get all of his medicines and cover all his disease states from an evidence-based medicine standpoint.
Did his physicians know that he wasn't able to afford all of the medicines he needed?
No, sir, they didn't. That was one of the issues on the first admission, because he was readmitted in the last couple of days, trying to explain to the physician why we needed to change all of these medications. And it's been difficult for them with the electronic medical record figuring out how to do this in the computer. And so there was a little bit of resistance to begin with, but I truly believe after today they now understand the restrictions that this gentleman has.
What do you think participating in the SafeMed program did for this gentleman?
I think in the end it's going to save his life, because he's going to be able to get his medications. He couldn't afford medications to treat COPD, and he continuously is here for COPD exacerbations. He couldn't get all of his hypertension meds, and he's here all the time for accelerated hypertension. So I truly believe that we're going to save this guy's life.